Welcome to this education video entitled Non-Life-Threatening Emergencies. This session is a component of our Project SAVE education video series designed especially for school staff, teachers, coaches, and others in the community that interact with children. Project SAVE stands for Sudden Cardiac Arrest, Awareness, Vision for Prevention, and Education. My name is Richard Lamphere. I'm a registered nurse and program manager of Project SAVE with Children's Healthcare of Atlanta, an affiliate of Wisconsin Children's Hospital, Project Adam, and I will be your presenter for this session. This education video is intended for adults who supervise children in schools, coach athletics, have minor children or family members at risk for non-life-threatening emergencies. In this presentation, we're going to focus on minor or non-life-threatening emergencies. Please note that while the injuries outlined in this video are typically considered non-life-threatening, there is a possibility that any of them could become life-threatening at any time. Always be prepared to call 911 in the event of any injury. It is better to have 911 there and not need them than to need them and not have them. For information on recognizing and responding to life-threatening emergencies, reference the Life-Threatening Emergencies video in this Project SAVE series. If you suspect or are unsure of an injury or illness, call 911 and implement your emergency action plan. For more information on an emergency action plan, view the Project SAVE All Staff Awareness video or visit the Project SAVE website. Here are the specific objectives for this education. Recognize non-life-threatening emergencies. Explain the need for securing help to prevent non-life-threatening emergencies from becoming life-threatening emergencies. And demonstrate appropriate treatment for minor emergencies. We will take a systematic approach from head to toe as we discuss different minor emergencies. For the purposes of this video, we will not be wearing personal protective equipment. However, in the event of an emergency, be sure to have the protective equipment available. Remember to take your first aid kit and AED to all emergencies. Your first aid kit should include the items listed here. Press pause if you'd like to note the complete list. You may add or subtract items on the list after consulting your medical team. Minor cuts or lacerations to the head may be misleading by the amount of blood that appears to be coming from the wound. The scalp has a lot of capillary blood vessels close to the skin that, when cut, will produce a lot of blood. Remain calm and use direct pressure to stop the bleeding. If the victim has thick hair, it may be difficult to find the source or location of the cut. You will need to slowly and methodically separate the hair as you look for the cut, similar to checking for lice. Watch as I demonstrate the proper way to treat an individual suffering a nosebleed. To help a victim with a bleeding nose, you want the person to tilt their head forward or down. Hold direct pressure or pinch the bridge of the nose with gauze as demonstrated here. Hold the gauze until bleeding stops, maintaining the position of the head tilted forward. If you are unable to control the bleeding, call 911. If the victim has lost a tooth as a result of a blow or hit to the mouth, prepare to transport them to the dentist or emergency department. Next, control the bleeding by providing direct pressure with gauze or have the victim hold direct pressure. Hold the lost tooth from the body of the tooth. Do not hold it from the root, as this may injure the tooth and minimize the chance of successful reimplantation. Place the tooth in a commercially made tooth solution of your choice. If you do not have a commercially made tooth solution available, you may use milk to preserve the tooth, or if this option is not available, you can use the victim's saliva. Have the victim spit into a cup and gently place the tooth in the container. Please note, blood may be in the saliva. this is not a cause for concern. Take the victim and the tooth to a dentist as quickly as possible. The chances of successfully reimplanting the tooth dramatically decrease after the tooth has been detached for an hour and a half or longer. Remember, time is tooth. Stings or bites can occur on any part of the body. The most important thing is to make sure it is safe for you to approach the victim. We do not want you to be bit or stung as a second victim. Ask the victim if they are allergic to any biting insects and be prepared to use the EpiPen. There is more information on using an EpiPen in the life-threatening emergencies video of this series. To remove a stinger, you can use a credit card to gently scrape the skin at the site of the sting, as demonstrated here. If you are bitten by a venomous snake or do not know if it is venomous, call 911. It is especially important to call 911 if there are changes in color, the area begins to swell, or is painful. If possible, take these steps while waiting for medical help. Remain calm and move yourself and the victim beyond the snake's striking distance. Remove jewelry and tight clothing before the victim begins to swell. Position the victim, if possible, so that the bite is at or below the level of their heart. If the bite occurred near a joint, immobilize the joint. Clean the wound by flushing it with water. Cover it with a clean, dry dressing. Try to remember the color of the snake or if you heard any noise before the bite. Do not do the following while waiting for medical help. Don't use a tourniquet or apply ice. Don't cut the wound or attempt to remove the venom. Don't allow the victim to drink coffee or alcohol, as these could speed the rate at which your body absorbs venom. Don't try to capture the snake. It is imperative that you leave the snake alone. Always try to identify the stinging insect or biting snake or animal. Again, be prepared to call 911 or poison control. Human bites may become a medical emergency if the skin is broken. Clean the area with soap and water and have the victim seen by a healthcare provider. Anytime a bite breaks the skin, whether from an animal, reptile, or human, the victim should be seen by a healthcare provider. For a suspected sprain or strain, you will want to rest the affected area. Have the victim lay down or sit out of any physical activity. Immobilize the area to help stabilize the affected extremity. To help minimize swelling, use an ice pack for 20 minutes. Do not put ice directly on the skin. If you are making an ice pack, place ice in a plastic zip-top bag and add water. Place the ice pack in a towel, then place the wrapped ice pack on the affected area. Do not leave the ice on for more than 20 minutes. For more information on sprains and strains, please visit the Children's Sports Medicine website listed here. If you suspect a broken or fractured bone, call 911 or seek medical treatment by a healthcare provider. For more information on broken bones or fractures, see our Project Save video on life-threatening emergencies. Remember, the most important step in pediatric first aid is prevention. Always do everything you can to prevent these occurrences. In the event of an emergency, remain calm, as your attitude can greatly impact the behavior of the victim. And remember, these non-life-threatening emergencies require immediate attention. Call 911, retrieve your first aid kit, and get an AED. Let's wrap up this video with additional resources for you to use. please visit our Project Save website or contact me, Richard Lamphere, using the contact information listed here. The Children's Healthcare of Atlanta Project Save video series is designed to help you feel confident to help in an emergency and save lives. The series has 5 topics, each available online for you to complete at your convenience. Benchmark CPR AED, which focuses on recognizing a cardiac emergency, providing compressions, and using an automated external defibrillator. All Staff Awareness, which focuses on recognizing an emergency and developing a proper response. Life-threatening emergencies, which focuses on recognizing and treating life-threatening emergencies. Non-life-threatening emergencies, which focuses on recognizing emergencies and preventing them from becoming life-threatening. And Cardiac Medical Emergency Practice Drill, which focuses on the implementation of an emergency practice drill. Please continue with the remaining videos in this Project Save series. You can complete the videos in any order and at any time. Share these videos with others who may encounter an emergency and would like to feel more confident in their ability to respond. This concludes the Children's Healthcare of Atlanta Non-Life-Threatening Emergencies video. For more resources regarding this and similar topics, please visit the Project Save website. From the Children's Healthcare of Atlanta School Health Program and Project Save, we thank you for watching this video.